Welcome back again to this channel. Now in this episode, we are going to be discussing about ectopic pregnancy after we looked at endometriosis in our last episode. If this is something that you're interested in, please like this video so that more people can learn about it. So let's go ahead and dive into the topic, ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside of the uterus. When most people think of pregnancy, they imagine a scenario where a sperm meets an egg. They fertilize inside of the fallopian tube, and then that embryo goes on to implant inside of the uterus. And while this is the case for most pregnancies, it's not always the case for every pregnancy. Sometimes that fertilized egg will implant outside of the uterus. This can be dangerous because the uterus has the blood flow and the nutrients necessary for that embryo or fetus to grow. Without these things, that pregnancy cannot be viable. So if a pregnancy is discovered to be ectopic at any point in time during the pregnancy, it is not going to be viable, and it does need to be discussed with your care team to determine the best next steps. There are many different places where an ectopic pregnancy can occur. Most commonly, it will be in the fallopian tubes. It can also occur in the ovary, in the abdominal cavity, or even in the cervix. However, 98% of the time, an ectopic pregnancy is going to be in the fallopian tube. So that's what we're going to focus our conversation around today. The reason why an ectopic pregnancy can occur is due to damage in the reproductive organs. That damage could have been caused by sexually transmitted infections, endometriosis, prior surgeries, even being overweight, or using a lot of tobacco products. There are also some cases where there is no known cause for an ectopic pregnancy. The most common type of ectopic pregnancy that occurs in the fallopian tube is called a tubal pregnancy. With this type of ectopic pregnancy, the embryo implants somewhere along the fallopian tube. Because the fallopian tube does not have the blood flow or the nutrients needed for that embryo to grow, it will eventually stop developing. At that point in time, it is causing the pregnancy to become non-viable. If the pregnancy is caught early enough, meaning it's only been a couple of weeks since the embryo implanted, oftentimes that pregnancy can be monitored expectantly, meaning the patient can go home and they can come back in a week or two to have their follow-up ultrasounds and blood work to check HCG levels to make sure that it is resolving on its own. However, sometimes that pregnancy will continue to grow despite it not being viable. This can cause the fallopian tube to rupture. And if this happens, it's very, very serious and it requires immediate medical attention. Signs and symptoms of a ruptured fallopian tube are going to include severe abdominal pain, vaginal bleeding, and sometimes even passing out. If you are experiencing any of these signs or symptoms, please seek immediate medical attention. It can be difficult to diagnose an ectopic pregnancy because a lot of the signs and symptoms mimic those of a normal pregnancy. Some of the common ways that an ectopic pregnancy can present are irregular vaginal bleeding, severe pelvic pain, shoulder pain, dizziness, or fainting. A missed period is also not always reliable because sometimes an ectopic pregnancy can still produce HCG. So if you've missed your period and you're having any of these other concerning signs or symptoms, definitely reach out to your healthcare provider to discuss further testing. The first line of testing that will be offered to someone who is suspected of having an ectopic pregnancy is an ultrasound. Ultrasound is not going to definitively diagnose an ectopic pregnancy, but it can help rule it out. An ultrasound can show if there is a pregnancy inside of the uterus, or if there is a mass in the area where the uterus and the ovaries are. If there is a mass, but it is not inside of the uterus, further testing will be required to determine where that mass is coming from. Another test that can be used to help diagnose an ectopic pregnancy is a quantitative HCG. HCG is what is produced by a pregnancy. In order to confirm that someone is pregnant, there is need to find HCG in either the blood or the urine. Normally, when we talk about an HCG test, we're talking about a qualitative test. That means it's a yes or no question. Is HCG there or is it not? With a quantitative HCG test, we're looking at how much HCG is in the blood. If that HCG level is rising appropriately, that is a good sign that the pregnancy is growing. If that HCG level is not rising appropriately, then further testing may be required. If it is found that the HCG is not doubling in 48 hours, then it is likely that the pregnancy is not viable. This can happen in both a normal intrauterine pregnancy or an ectopic pregnancy, so it's not specific to one or the other, but it is one piece of the puzzle that can help us determine what is going on. Other tests that can be used to help diagnose an ectopic pregnancy are going to be a laparoscopy, which is a surgery where the inside of the abdomen is looked at through a little camera, and a D&C, which is a procedure where the inside of the uterus is looked at too through the cervix and the lining of the uterus is scraped to determine if there are any abnormalities in the tissue. Treatment for an ectopic pregnancy is going to depend on whether or not the fallopian tube is still intact or if it has ruptured. If the fallopian tube is still intact, the patient has the option of continuing to monitor the pregnancy. Doing an IVF or in vitro fertilization where we remove the pregnancy from the fallopian tube and place it inside of the uterus. Or the third option is to do a laparoscopy to remove the pregnancy from the fallopian tube. Each of these options needs to be discussed with the patient and their care team to determine what the best option is. If the fallopian tube has ruptured, then the patient is going to require emergency surgery to repair the tube. However, if the tube is too damaged to repair, then it may need to be removed. And at that point in time, the patient will no longer have a fallopian tube on that side. Recovery from an ectopic pregnancy depends on the treatment that was provided. If the patient had a laparoscopy, it usually takes about 2 weeks to recover from that surgery. If the patient had their fallopian tube removed, recovery is going to take a little bit longer, and the patient will need to take time off of work. It's recommended that patients wait at least 6 weeks after their surgery before they resume strenuous activity, including sex. After an ectopic pregnancy, patients often wonder if they are at risk for another ectopic pregnancy. Yes, you are at higher risk for another ectopic pregnancy. So it is important to continue to follow up with your care team. During those follow-ups, your care team will ask you questions about your current symptoms and perform a physical exam. Your care team will also want to perform an ultrasound and check HCG levels to make sure that the pregnancy is resolving. Unfortunately, there's no real way to prevent an ectopic pregnancy. However, you can reduce your risk of having one by getting tested for sexually transmitted infections and practicing safe sex. If you enjoyed this video or you learned something, please hit the like button. And if you haven't already, please subscribe to the channel.